We know that the vaccinated can efficiently transmit COVID-19, including to vaccinated people. That's the science now, and it's generally accepted. So in that case, I'd like to know, what is the scientific rationale for continuing and expanding vaccination certs? Is there a shred of evidence? It appears that there was no evidence in Wales. It was discussed in the Welsh Parliament. So what evidence do you have? What evidence does your government have to do it? Because if there's no evidence, then why are we doing it other than to deflect blame from a government that's done nothing to address the capacity issues in our healthcare system? Because we have 95 people in trolleys in Limerick today. Over the past 8 weeks, there were 27 outbreaks linked to hospitality, 8 in gyms, 6 in hairdressers, and 283 in healthcare sittings. So we've 95 people in trolleys in Limerick. Now, you might say, oh, well, that's because of the COVID, the upturn in COVID. But it's not, because on the hottest day of this year, when there were only 95 people in the entire country in hospital with COVID-19, there were 49 people on trolleys in Limerick. So this issue of overcrowding in Limerick is clearly exacerbated by COVID, but is not limited to COVID. And I discussed this with Simon Harris when he was Minister for Health, and he promised the sun, moon and stars with regard to the alleviation of overcrowding, and nothing has been done. So instead of dealing with the problems, the lack of capacity in our healthcare system, the government is focusing on increasing outdoor dining in the middle of winter, and expanding a vaccine pass that I've seen no evidence for. If you show me evidence for it, I'm willing to consider it, but I've seen none for it. That exemplifies what is wrong with our COVID response in this state and why we are failing.